Hi everybody, this is Dr. Vânia, Dr. Vânia Martins, your Brazilian British gynecologist in London. Today I'll have a pleasure to talk to you about the difference between premature menopause or ovarian failure, premature ovarian failure, and early menopause. Okay, there are two different terms with very dangerous consequences in women's health. So the first one, called premature ovarian failure, when your ovaries stopped working before the age of 40. Okay, so what are ovaries? Your ovaries are the two organs here that produces hormone, your female hormones, other hormones that you need to become more energetic, attractive, and so on. So when it happens, okay, and then as a consequence, your menstrual period usually starts become irregular first. And when you are definitely in premature ovarian failure, it's usually 1 year or more that you don't see your periods at all. They completely disappear. What about early menopause? Is when your menopause comes between the age 40 to 45. Did you understand the difference? The first one, premature ovarian failure, before 40. Early menopause, between 40 and 45. Why I'm talking about this? Because both are very dangerous for us. Why? Because it might start, we can open the problem, the symptoms with depression or even anxiety, or we might open the symptoms with lack of lubrication, low sex drive, maybe put too much weight in the belly and the thighs, for example, hot flushes, insomnia. So there are more than 50 symptoms that can become related to those two diseases, okay? You need to be very cautious and pay attention. First of all, to your periods, how often they come, how many days they are, if they are light, if they are heavy, how they used to be before, how they are now. It's very, very important. Another point is look at your state. Maybe you are feeling low in energy because maybe you're working too much or stressed to just have the baby or working extra hours. Might be normal. But sometimes might be linked to premature ovarian failure or early menopause. Okay, why it is important to give you the diagnosis and that you look for help? Because it can give you osteoporosis, mainly in a country like England that the sun is quite rare. So you don't go out much, you don't take sun bath a lot. So, and then it's important. Also, it can be difficult for you. You can have some problems with cognitions, like me. Remember things, sometimes you can become forgetful. Sometimes you have no sex drive at all, or you feel that your vagina is more dry, or you don't feel, don't have orgasms as it used to be. Sex is not as pleasure as it used to be before. You don't feel like have intimacy. Intimacy does not mean having sex. It means cuddling and touching your partner, okay? So there's just small pieces that you need to put together in order for us to help you. So after you think, okay, I might have this, you look for help. The gynecologist or specialist in menopause is gonna help you to treat that, because you can have HRT hormones. Some patients, they cannot have HRT, they're gonna have other treatments with a physiotherapist or naturopathics. So I'm a doctor, I'm a gynecologist, so I very fond of HRT hormones, and I think they help women. It's not for everybody. You need to have your checkups first, have a smear on time, your ultrasounds, your hormones. See if you can go through this, because if some diseases might be difficult for us to give you some hormones. So sometimes we need to send you to how can I say, organize your body first, and then you can start with HRT. But some small tips: exercise might helps, good night's sleep, loads of water. Try to have some time for yourself. It's very, very important, okay? So this was Dr. Vânia Martins. I hope I have helped you with these tips about premature ovarian failure or early menopause. So if you feel suffering from this, look for help, look for some advice. Don't take it to go because you can have loads of issues in the future, because the symptoms, they come quite slowly. When you see you are in the trap, it's more difficult for the doctor to help you. Okay, so this is Dr. Vânia Martins, your Brazilian British gynecologist in London. I see you in the next video here in Vânia Healthcare in Hampstead. We have a page on Instagram called at Vânia Healthcare, okay? And also your page on YouTube is Vânia Healthcare. And I see you in the next video. Bye bye.